Hi, Dr. D. Pasquale from NSI, and one of the most common things we see as it relates to spine conditions is failed surgery syndrome. And this has become an epidemic. We see quite a bit of failed surgery syndrome type issues, primarily because the literature is very clear. The likelihood of individuals failing in a surgical setting for spine-related issues is extremely high, and there's a reason. Most of the problems that occur as a result of the degenerative process, or the pain, I should say, or the symptoms associated with the degenerative process, the pain is not the problem. And when we continue to mask symptoms with medication, remember that it only allows us to get worse over time. It allows that tissue to continue to degenerate over a long period of time. And then the next available tool is typically surgical intervention. And the methodology behind the surgical intervention is, again, for symptomatic relief. So as an example, let's say, if this is a model of a spine, and this represents a disc herniation. If you're unfamiliar with a disc herniation, let me kind of give you a better idea what that looks like. So when it becomes herniated, this is a normal disc. It's almost like a jelly donut, right? So the outer ring surrounds a gelatinous material. When it herniates, it comes towards the outside and it's able to irritate the nerve roots and as a result create things like sciatica or nerve pain. Now when we go in and we just cut this out to relieve that pain pattern, the circumstances that created this from the get-go have not changed. And what we'll see is, first of all, we cut the disc out, which destabilizes the motion segment. It causes more stress and wear and tear over time, which leads to more degenerative change. But more importantly, cutting this out to relieve symptoms doesn't really change the overall function of the low back, or at least in terms of the motion segment. And all of the situations that led to this problem will still be in play. More importantly, there are other pain-sensitive structures. This is the disc, but then we have also facet joints here on the back, and if you can see them, I'll open them up. In between these joints are cartilage surfaces. And when we cut a disc out, the disc is primarily one of the weight-bearing structures of the spine. And when we destabilize that, when we don't have the ability to support weight in the disc itself, we then transfer weight to the facet joints. And what that does, because they're not designed to bear as much weight, what that does is it wears out the cartilage in between them. And now we're dealing with, 4 or 5-year follow-ups actually is where we start to see people fail with discectomies and laminotomies and minimally invasive procedures. At about the 5-year mark is when we start to see failure, and it's primarily because all of that repetitive stress as a result of destabilizing the disc is starting to set in, and it's starting to create other issues, and that's traditionally what we see. So, when it comes to failed surgery syndrome, we talk quite a bit about fusion surgeries and the likelihood of fusion surgeries failing long term, and that number is really high. I mean, even in terms of 2-year follow-ups. And we're all consistent with that. We all understand that process, but also with microdiscectomies and laminotomies, which are the minimally invasive procedures, remember that it's just a short-term fix, and as a result, the likelihood that you'll need multiple surgeries down the road is very high. In this environment, and the reason why we can be very successful in preventing those issues from occurring is because we can repair tissue. And that's an important thing to understand. Yes, stem cell therapy is really important part of the process in repairing tissue, both the facets as well as the discs, as well as the interspinous ligaments, as well as the myofascial tissue. We can repair it all. But once we have surgery and we fail, does that preclude you from receiving treatment? And the answer is no. We've been very successful at helping people overcome their problems, even if they're post-surgical. What I'll tell you is that there's going to be some limitation. We can't unboil a hard-boiled egg, unfortunately. But what I say to patients, or what I do with my patients, is I make sure that I'm very upfront. As long as there is an indication for treatment, and I feel very confident that we can repair and regenerate tissue, remember that the repair and regeneration of cartilage, the repair and regeneration of ligamentous tissue, the repair and regeneration of musculoskeletal tissue has been well established in the literature. So as long as on diagnostic tests like MRI or CT scan, we see that there are tissues that can be affected, tissues that can be improved, then yeah, we're going to tell the patient, look, there's a mechanism by which I can see a positive outcome. Here are the circumstances. Obviously, this is a very minimally invasive process with very little downtime, very little risk. So, and then we make decisions together with that patient, and we've been able to be very successful with some individuals, with many of the individuals, I should say. Where I was going was I always talk about certain types of patients, or not types, but certain patients. And there's one that comes into my head all the time. He came here to the Brandon office, and he had a 5-level fusion. He was 3 times post-surgical. He was in his late 50s. What that means is he had 3 lumbar spine fusion surgeries with revisions. He had multiple complications. One was hematoma that left him bedridden for 9 months. He had to learn how to walk, and his quality of life was really horrific at that stage of the game when he came to see us. And on opiates, on traditional pain management at that point, because he really had nowhere else to go. And when he came to see us, I said to him, look, what I know for sure is that the stem cells present in your body will heal and regenerate specific types of tissue as long as I can see, a mechanism by which I can improve those conditions. Then it would make sense from my end to move forward as long as you're comfortable with that. But we can't guarantee anything in that particular case. And I said to him, look, as long as you're okay with making that decision, I feel pretty confident that we can get many of the tissues in your back to respond. And we made the decision together to move forward, and he was out of pain for the first time in 16 years after 6 weeks with 1 series of injections, off all of his medication, completely changed his life. And you know what, it's really an amazing thing, especially for a post-surgical individual who's been told that there's nowhere else to go. The best you can do is just manage the symptoms with medication, and that's not a good place to be. So, it's if you've had a surgery and you failed, you're not alone first, and more importantly, there are things that we can do in a regenerative medicine model. There might be some limitations, but that's okay as long as we can improve the condition and get you doing the things that you enjoy.